Hello, everyone, and welcome. This is TJ Anderson with Heads Up Health, and today I'm joined with one of our great members of our health professional platform, Dr. Kevin Sprouse. Kevin, thank you for joining me today.
TJ, thanks for having me.
Yeah, so you are excited if you will share a little bit more about your practice with everyone, and how long have you been using our platform as well?
Sure. Been using your platform, I want to say about 6 months or so, roughly. My practice is one that focuses on sports medicine and then all tenets of kind of performance, whether that's athletic performance, cognitive, really uses the science from sports medicine, sports science, and brings it to the rest of us. Most of my patients are, about 70% of my patients are professional athletes. 30% are recreational guys like me who enjoy getting out and being competitive but don't make a paycheck from it. And we started using Heads Up about 6 months ago, really as a way to dig deeply into some of the metrics we gather and follow on our patients.
Awesome. So you have your own practice and you're specializing working with athletes, so mostly professional athletes, but not all. And you chose to use Heads Up to kind of dive deeper on the data and the analytics for the performance. So tell us about your practice a bit. Is it mostly remote? Is it a mix of remote and in person? And ultimately, why did you choose Heads Up over other platforms?
Yeah, so my practice is a mix of remote and in person. I'm also the medical director for a world tour cycling team, like a Tour de France team. And in that team, we have various dashboards and tools that we're able to use to keep track of our riders, our patients. And so within my practice, I was kind of monitoring a lot of the same metrics, be it hematology and blood work, sleep from Aura, Whoop, recovery metrics, daily weigh-ins, training load, all kinds of stuff. But in my practice, I didn't have the same tool to kind of put that up on a dashboard, either view it quickly for all the patients or dig in deeply for individual patients. So when I started looking for options, I came across Heads Up and saw that it basically was providing exactly what I wanted to have for my patients. And not just that, it had a component to it that was very malleable, that you guys were willing to kind of put in things that would be helpful for me, and we could get rid of stuff that I'm not using and really tailor it to what I need, so that when I sit down with a patient, which can be in my office, it can be remotely. A lot of times it's at events. So I work with a lot of PGA golfers, Ironman triathletes. A lot of times it's me being where they are and being able to pull this up and go over it. So it kind of just ticked all the boxes for me.
That's great. Awesome. That's a good point to mention, is that, we're not just like a standalone software. You really enjoyed how you were able to customize and tailor it for you, for your practice and your athletes. And of course, it's something that you can have anywhere in the world. And it serves as a remote monitoring platform so that you don't have to be in person to be able to support people, because of the access that your clients have to our platform. So awesome, that's great, and I love the work you're doing, by the way. And so you obviously know health, you obviously know performance. You're working with some of the top athletes in the world, and you chose Heads Up. And okay, so what else about Heads Up do you kind of really enjoy and that you've been using recently in your practice?
So one of the most recent features that I think has really made Heads Up more, just has really increased the value in terms of how we utilize it day to day, is the analytic function. And we've rolled this out with some of the assessments we do. So when we bring a patient on, we'll do blood work, and we'll dig into their health history and look at their medical records and start to monitor sleep or look at what they've done in the past. And so that's kind of a starting point. What we want to see is, from that point, when we make interventions, how does it change things? Hopefully for the better, but not always. I mean, there's some guess and check and there's some individuality. And so being able to keep an eye on things and trend them is really important. The analytic function For instance, we've started using it in our sleep assessments. So when I sit down with a patient, we may look at their last month of sleep metrics and graph that using the analytics. So it may be total sleep, deep sleep, REM sleep on one page. We may look at HRV and HRV-CV on another. And not only just look at the last month, but then compare that chunk of data to say a month or 2 months or 3 months that happened, in the past, 6 months ago or a year ago. So we can see where they were prior to an intervention and where they are now post-intervention. And that, I think, is really powerful, both for us as practitioners in checking what we're doing with patients, but also in giving them a kind of a rationale and some confidence in what they're doing. In medicine, a lot of times the tests we run, we kind of know what the answers are going to be. I mean, not all the time, but a lot of times the data really serves to be a reminder to the patient and push the patient and say, okay, you're making progress or you're not. And then they say, oh, well, I haven't been compliant. Okay, now I'm going to try to move that number. It kind of gamifies it. And so this is a way that augments that a bit. They can see their numbers, they can see the trends, they can see if they're making the changes they think they are.
Love it. I just thought I'd quickly share my screen as well. So what you're talking about, the newest analytics feature, for those that might be wondering, is our analyzer. So the analyzer on our desktop version here, again, our platform pulls in both lifestyle and clinical data. And then we can pull in any of those data points here on our analyzer for both the individual, so your patients, or you as a practitioner to run reports and run analytics. And like you said, you were doing some sleep analysis for your patients, and you were comparing the last 4 weeks to past historical data, and then able to see how they're trending. So down here, you're able to see how different metrics are trending compared to different time periods. And then specifically, you're able to export a PDF or PNG or CSV that allows you to share that with your patients and your clients. And like you said about the data, the power of data, yes, it can confirm things for people. For patients, it might inspire behavior change, serve as like a little bit of a gamification or a feedback loop. And that's kind of how it's helped you with your patients in terms of having them, actually see the data and be like, oh, look, you've made great progress here. So, look, what can we learn about this data from the analysis?
Yeah.
That's great. Awesome. So my last question for you, for other people that might be in your shoes, like a practitioner looking to advance outcomes, save time in their practice, like what other benefits, what would you share to someone, a doctor that might have their own private practice, that's interested in taking advantage of something like Heads Up and might want to learn how they can best use this in their practice? What might you recommend to someone in their shoes?
I mean, I think the biggest benefit from an overarching theme standpoint is that we collect so much data on our patients from varying sources, whether that's the Oura Ring or glucose monitors or scales or blood pressure. But we typically look at them in isolation. Even if we try to combine them, like try to look at them together, it's pulling, it's having two screens up and having one here, one there, and trying to figure out how it's coming together. So this is a tool that allows you to pretty much overlay whatever you want. So I'm in sports and performance, and the way my dashboard is set up and my analytics, it reflects that very obviously if you were to pull it up. But if you're in managing chronic illness or diabetes or any number of things, like it will look different for you. But the idea is the same. You're pulling in the metrics that are important to you. You're getting rid of the ones that aren't. So it's not overwhelming. I think that's really important because it comes just noisy otherwise. And you can really focus down on the interaction between important variables. In terms of learning more about it, you can probably tell us more, but I think that Heads Up probably has some resources to reach out to you guys, whether that's having you walk them through it or videos or whatnot. But I think I would certainly recommend playing around with it and seeing if it fits your practice, because I think it's very malleable and will fit lots of needs.
Love it. Well, that's such a great point to end on, is how malleable it is. And, we do go to great lengths, like you said, depending on different practice niches. We can customize the clinical data dashboard and the lifestyle data dashboard, so you can have your patients and your clients focus on tracking what you want them to track. Like you said, sometimes it can get really overwhelming, and people can lose focus on what's most important to track. And so we can actually pull out and only show what you want your patients to track. So that's awesome. Thank you so much for being such an awesome member and doing great work in the world, Dr. Sprouse. And we're excited to keep supporting you in your practice with our platform.
Thanks, TJ. I appreciate it.
You bet.